Chem 107 students, this is our last video for Chapter 10 on medical imaging. We're going to talk very briefly about x-rays, mammograms, CT scans, fluoroscopy, PET scans, ultrasound, and MRIs. Not all of them use ionizing radiation, however. X-rays. You're familiar with this kind of scan, and you've probably had an x-ray. What is this x-ray of right here? Can you see? Yeah, it's a human female pregnant. You can see the spine of her baby, can't you? So that is an x-ray, and x-rays show bone in white. They're very useful for bone scans. So x-rays are also called projectional radiographs. They do use ionizing radiation that is energetic enough for the radiation to hit an atom and knock an electron off. The ionizing radiation has enough energy to penetrate human tissue. X-rays are commonly used to examine bones, fractures, chest, abdomen, and teeth. How does an x-ray work? The beam goes through the patient and some radiation is absorbed. That's called attenuation. Denser tissue absorbs more radiation, so it doesn't pass through. Bone absorbs more than your organs, for example. The more radiation that passes through, the darker the image. So when it's absorbed by bone, it doesn't pass through and it appears white. So bones appear white on the image. Lungs, which are mostly air, don't absorb x-rays hardly at all, and they appear black. So the dense tissue will appear white, and less dense appears black, and everything in between. So that's how an x-ray works. Mammograms. So on the left side, we have a normal tissue. On the right side, we have some cancer in that tissue. So that's a mammogram. Mammography is the process of using low energy x-rays to examine the human breast for diagnosis and screening. So x-rays, again, are not something you want to have all the time. So I need to mention that. X-rays are something you don't have with a physical every year. You only have an x-ray if you medically need to, if the benefits outweigh the cons. So we don't want to have a lot of x-rays in our lifetime because it does have a little bitty chance of causing cancer. So again, a regular x-ray isn't horrible, but you just don't want to have a lot of them in the same year. So mammograms are x-rays, but they're lower energy x-rays, so safer. So we do have those on a yearly basis. The goal of a mammogram is to detect breast cancer, typically through the detection of characteristic masses or microcalcifications in the image. Mammograms use lower energy x-rays than bone images. And the new digital mammography uses even less energy, which is the most safe for the patient. So if you or a female you know, like your mother or sister, is getting mammograms every year, try to get digital mammograms. Those are better. CT or CAT scans are the same thing. Here's two pictures of brains. These were used in a court case. Terry Shriver's brain is on the left in blue, and a healthy brain is right in gray. You may have heard about Terry Shriver. It was a Florida woman who went into basically a coma, and the brain scans showed after her accident that her brain was dead. So her husband was ready to pull the plug and let her pass away because her brain was dead. But her parents argued no, they could pray for a miracle and something maybe she could wake up someday. So they sued to prevent her husband from pulling the plug. And this was a big case in Florida, and it made national attention. Who has the rights to pull the plug? Eventually the courts, it took a long time, many, many months, but eventually the courts did side with the husband. CAT scans or CT scans. Computer axial tomography is what that stands for. These make use of computer process combinations of many x-ray measurements taken from different angles to produce cross-section images of a specific area of the scanned object. It basically allows you to see inside the object without cutting. CAT scans are very useful, and they're typically used to image soft tissues such as the brain, lungs, heart, and colon. These x-rays, however, are at a higher dose than a typical bone x-ray, so you need to have a good reason to have a CAT scan. An abdominal CAT scan is about the same radiation as 300 bone x-rays. Some estimate that about 0.4% of cancers in the United States are due to CAT scans. So again, you need to have a good reason to have a CAT scan for the doctor to prescribe it for you. Fluoroscopy. So these images are actually from my spine. If you can see the image right here closest to me, upper, the higher one, those are 4 needles coming in from the left side into the facet joints of my spine, and they're injecting medicine, which is that purplish spot in the middle. So we're injecting some medicine into my spine, which makes it easier for me to walk. So I get these injections in my back, in the facet joints. Now, the farther image is just little pin marks on the screen showing where we want to inject the needles. So this is called fluoroscopy. Fluoroscopy is a type of medical image that shows a continuous, real-time X-ray image on a monitor, much like an X-ray movie. So it's not pictures. You don't get filmed from this. You watch it on a screen. During a fluoroscopy procedure, an X-ray beam is passed through the body. Fluoroscopy uses low doses of constant X-rays so the doctor can watch the procedure on a monitor, which is what the previous pictures were, some pictures of a monitor. It is used for catheter or needle guidance, so the doctor can watch the image and guide the needle to the right spot. Discography, which is what I was doing. Orthopedic surgery guidance, for example, or placing metal implants. The patient is placed between the X-ray source and a camera, which records the image that plays on a monitor in real time. So I used to sit there and watch on screen these needles going into my back in the right spots and then injecting the medicine. So it was pretty cool. So that's fluoroscopy, low dose X-rays for real-time movies. Next is PET scans. So here we see a brain. On the left is a normal brain with lots of red. On the right side is a brain on cocaine, and we lose some of that red, which is brain function. So a PET scan is a positron emission tomography scan, PET scan. It's an imaging test that reveals how your tissues and organs are functioning. A PET scan uses a positron-emitting radioactive isotope to show this activity. This scan can sometimes detect disease before it shows up on other images. Some positron emitters include carbon-11, nitrogen-13, oxygen-15, and fluorine-18. The positron emitter is usually injected into the bloodstream. Then you wait while it concentrates in the tissue of interest, like the brain. Then you scan that tissue. The positron annihilates a nearby electron, which produces a gamma ray, which is detected by the scanner to make the image. So positron emission tomography, PET scans. Next up is ultrasound. I assume you can figure out what that is. Yeah, it's a baby's head, right? It's an ultrasound. Now, ultrasounds do not use ionizing radiation, which makes them a lot safer. That's why we use them on babies in the womb, so pregnant ladies. Ultrasounds are used to create images of soft tissue structures, such as the gallbladder, heart, liver, kidneys, pancreas, bladder, and other organs and parts of the body using sound waves. So these are sound waves, not ionizing radiation waves. Ultrasounds can also measure the flow of blood in the arteries to detect blockages. Ultrasound testing is very safe and easy to perform. It's also pretty cheap. High-frequency sound waves are transmitted to the area of interest and the returning echoes recorded. The most common application is to produce images of a fetus in the womb. Ultrasounds are cheap, inexpensive, and can even be portable. So you can carry it out onto the battlefield if you're a medic in a war. Because it's a real-time scan, ultrasounds can be used to guide needles for biopsies. So you may have had an ultrasound before and they're safe and it's not ionizing, so it can't cause cancer. So very safe. It's just they're not the most useful type of scan, which is why we have to do those others sometimes. And finally, MRIs. MRIs, to me, are the best scans. They are also extremely expensive, which is why your insurance doesn't want to pay for them. So you have to have a really good reason to get an MRI. But look at that image. It's a cross-section of your head showing the brain. MRIs are amazing images. Like ultrasounds, MRI scans do not use ionizing radiation, which makes them totally safe and they can't cause cancer. So ultrasounds and MRIs, remember this, are not ionizing radiation. So MRI stands for magnetic resonance imaging. It's a medical imaging techniques used in radiology to form pictures of the anatomy and the physiological processes of the body. MRI scanners use magnetic fields, magnetic field gradients, and radio waves. Radio waves, see, not ionizing, low energy radio waves to generate images of the organs in the body. The powerful magnets, which is why you have to remove all metal like earrings and rings and jewelry and piercings. The magnets and radio waves excite hydrogen atoms in water and they start to spin a certain way that is detectable and converted into these magnificent images. The more hydrogen there is, the image is white. So water, H2O, has a lot of hydrogen in it, right? 2 H's for every 1 O. So water is going to be white. What contains a lot of water in your body? Fat cells. So fat cells contain a lot of water and they appear white. Now, in the spine, this is very useful. Hydrated discs are cushy and appear white, while degenerated discs do not have water, they're not cushy, they're smushed, and they appear black. So it's very good to use on spine injuries. You can tell if the discs are dehydrated and degenerated. So I've had one of these done myself. MRI scanning is non-invasive and it's painless. So MRI scans are great, except they're so expensive. But they do not cause cancer, they're not ionizing, they're non-invasive, and they give beautiful images. So here's a couple of images of a back. One of them is mine. So you can see the hydrated discs are white. They appear white. And then if you look at the one closest to me, it's white discs, and then suddenly see that one that goes black? And then there's one within the lines that's really black, and then the other one's black, and the bottom one's black. So there's 4 degenerated discs in that spine. That one's me. So I've got 4 degenerated discs in my spine, which is why I get those facet joint injections. So again, water appears white, hydrated, things with water appear white, and things that don't have water appear dark. And that's actually our last slide. So we have finished up our chapter 10. I hope you enjoyed it as much as I love this chapter. And don't forget to watch the video on writing and balancing radioactive processes, the alpha, beta, and gamma video as well. Bye, 107 students. Have a great day.